Hi, today we're going to be doing a 15-minute skill video. I chose to do just a basic assessment. Now, there's four main steps to this basic assessment. There's the scene size up. This starts before you even get out of the ambulance. This comes in when you get dispatched out. Sometimes when you're dispatched out, they will tell you to stage for law enforcement. And once law enforcement clears you, you can come up there. Still, be vigilant and make sure that nothing's going to happen. Scene size up includes number of patients, scene safety, environmental factors, and potential hazards. So when you're pulling up to a house, even if there's been no dispatch for you to wait, you need to make sure that this looks like a safe scene. Is there a dog, for example? Is there any type of environmental hazards? Is there stairs? Well, you need a stair chair. This is you building the initial assessment because you are going to be walking into this house with very, very limited information. So, do you see dogs? Do you see trash everywhere? What do you see? It could be as simple as, okay, they have front steps porch, or, oh, there's a gun laying right there, and there is somebody screaming in the house. Another part of scene size up, for example, you are responding to a car accident. This will be the mechanism of injury. Did the car's T-bone? Was it a head-on collision? Was it a rear end? Did the car hit a deer? Where are the patients located? Did airbags go off? Just some stuff to keep in mind while you're going to go up to the patient. You want to see what happened. Next up with the patient assessment will be the primary assessment. This is your general impression. How does the patient appear when you walk into that house? What do they look like? Where are they sitting? Are they bent over like this, struggling to breathe? Can you hear them breathing when you walk in? Can you see the accessory muscles in use while they're breathing? This is, a big part of this is the ABCs, the airway, breathing, and circulation. So airway, is their airway clear? Can you hear any gunk, mucus? Is there a whistle sound? Is there wheezing? Okay, you can hear this with the airway. This also goes along with breathing, as in how are they breathing? Accessory muscle use, wheezing, sounds. Now airway being clear means there's no obstruction that you can see, and there's no obstruction that should be causing any issues. With breathing, how are they breathing? Listen to lung sounds. Lung sounds are huge. A lot of people forget lung sounds. Does it sound all gunked up, crackly, wheezy? You know, this is all stuff that'll clue you in on what's going on with this patient. Then circulation. So this patient's complaining of left arm numbness. Well, first, let's see if is there a pulse? Do you have a pulse in the left arm? You know, stuff like that. You want to make sure there's pulses. You need to make sure that their capillary refills are good. Press down on their finger, count the seconds for it to refill. You know, stuff like that. It all helps with finding out how the patient is doing. Another large part of your primary assessment, I mentioned the position that they're found in. You also need to see the color of them and how do they feel? How are they talking? You want to be able to determine their mental alertness here. This is as simple as a question of how many quarters make a dollar. You know, they can give you an answer. Well, what year is it? Now, some people might be a little teeter-totter, especially right now since the year just kind of begun. Similar with president, that's a difficult question. I don't personally like asking that question. It's a very biased political question, so I try to steer clear of the president question. What day is it? That's also a difficult question for some people to get correct. I don't know what day it is half the time. So you have to figure out these questions to ask. My favorite is how many quarters are in a dollar. Or I like them to say their name to me. And I like to ask them a couple questions about themselves. You know, and then you can ask, what color is the sun? What color is the sky? Some basic stuff that they should be able to get right and give you appropriate answers for. This way that, you know, they're not going to get biased or upset or agitated with you for asking something like the president. Because in 2020, you ask somebody who the president was, they might get all upset and say the president they think it is, they think this should be, instead of the actual president, and they could be completely mentally coherent. You know, so it all just depends, and it's one of those things that I wanted to mention here because that question is not a very good question. The third step to building up your basic assessment is the vital sign measurements. Now, very often, while you are getting your primary assessment, you're putting the vital signs up there. You're also, my next step here is going to be the sample history. You're also getting your sample history. You're doing this all around one time. You and your partner are doing this together. However, your vital signs, you want to get all your basic vitals. And you want that very quickly as well. Blood pressure, oxygen saturation, heart rate, temperature, blood glucose. You want all of that ASAP. That blood sugar's low, well, that's why they're not making sense. Their blood pressure's high, well, probably why they have the headache and the body aches. So it's one of those big things that needs to be happening while you're discussing with them and getting their chief complaint in the primary impression area. When you're getting your general impression, you are also getting your vitals. And usually your sample history around the same time if there's bystanders and the patient's coherent. If there's not bystanders and the patient's not coherent, well, you're going to have to do the best you can sometimes. Something that's a very serious part of building your primary assessment is your head-to-toe exam, and very often it is left out. You want to assess this patient from head to toe. I know when you're on the truck, when you're on that call, it's not your top priority. However, this patient's running a fever. You don't know what's wrong with them. You know, they're looking like they might be a little sepsis, and well, lo and behold, when you remove the shoe, they got a rotted toe. They have an infected toe. Well, now you know for sure what you should be doing and what section of treatment this will be, what the path should go down. So it's one of those things that is very often forgotten, but I feel like it is a very, very important part of this. Because you want to make sure there's pulses everywhere. You know, you want to make sure there's no open injuries anywhere in their clothing. You want to make sure that that chest pain that they're feeling when isn't some abdominal swelling and bruising there from when they fell. Here soon we are going to be doing a scenario, so stay tuned.
You guys recording?
Yes. Back here.
Okay.
Grandpa.
What?
Grandpa, what is going on with you?
There's a person out there.
Yes.
There's bad people. Bad people coming here for us. Bad people.
Grandpa,
They're
calm
bad
down.
people coming
Calm
here.
down, Grandpa. Calm down,
Don't you
Grandpa.
touch me,
Okay.
you demon.
Just calm down.
Hey, I tell you what.
Just calm down, Grandpa. It's just my friend. I've called him to
Who's your friend? Who is it?
He's going to come look at you and check
What are you gonna do?
Hey.
What's he doing? Who is this?
Hey, what's going
I don't
on?
like it. Who are you?
Grandpa has
Who are you?
been acting a little strange today.
Hi,
I'm not
I'm
sure.
Tannis with
He's a little
EMS.
Paranoid. Not really himself.
Who are you?
I was hoping you could help check him out and see what he's
Why are you in my home?
Hi, I work for EMS.
What's that?
I'll check it out for you.
Thank you.
Yeah,
But
I drive the ambulance.
He shouldn't hit you, but just, you know.
Is he usually like this?
No, he's usually really, really nice. He's hard of hearing though, so you might have to repeat yourself quite a few times. But it's not that. Normally when he's hard of hearing and he don't understand you, he's funny.
Okay.
You know, he just
okay.
takes it in stride and nods. This is different. This is like, I don't know.
Okay.
Why are
when did
you
this
here?
start?
A few hours ago.
I'm just here to talk to you.
What do you need?
I'm just here to talk.
Why are
to
you in my home?
Just to talk to you, say hi.
Why?
Because I heard that you could use some company.
Company for what?
Just to hang out for a second.
What are we doing?
We're just chilling. We're gonna play on my cool computer here.
Funky looking thing, I tell you what.
Yeah, that's pretty clunky.
I don't like it.
Oh, you wanna look at it?
No,
Now how about we check it out? Let's see what he's got going
let's
on.
do some,
You want to
let's do a
sit down?
checkup, okay?
I don't
Grandpa?
trust that. No.
It's okay, Grandpa.
Has he eaten today?
You know, I'm not really sure. I live next door. He hasn't had any lunch that I know of. We did
Eat.
do his
Food?
medicines though. And I know he
Okay.
drank some water with his
Good
medicine.
stuff.
You like food?
Yeah,
Did you have any food today?
probably.
What kind of medicine is it?
I mean, there's all sorts of things. There's blood pressure. There's
Is he
um,
diabetic?
Ain't pressure
he
good.
is diabetic. He is on insulin, and we did give him his sugar or his insulin this morning.
What's
The insulin?
that?
Yeah,
Hurts.
it hurts.
Bad stuff. I don't like it.
I'm sorry, but it helps you, right?
Did you take your insulin
I
this
don't
morning,
know.
Grandpa?
Who?
Did we do insulin this morning, Grandpa?
Maybe.
Maybe. Okay, well, he does need to take his insulin. He usually runs high, so.
Well, can I check you out real quick?
It's cold in here, I tell you what.
Oh, I can get you a blanket.
Where?
Right here, I got a blanket right here for you. You want to sit on
Hello
down? I
Kitty.
can wrap you
That's your
up.
favorite.
I heard you like Hello Kitty.
I don't like it.
You don't like it? What about this plain white one right here?
Come on, Grandpa. Sit down and let's wrap you
Let's
up.
sit down and wrap you up, man.
Diego, you see great Grandpa?
Why don't you take a seat right there for me?
Great
I
Grandpa
don't know
sure
you.
is fine.
That's fair.
Come on.
I don't trust you.
That's fair.
Grandpa, it's all right. Look, I'll sit down beside you. Let's sit down, Grandpa.
Listen, my name's Tannis.
He ain't good for us.
He's good. He's good.
My name,
I don't
It's
trust.
okay, Grandpa.
I don't trust.
what's his name?
His name is Joseph.
Mr. Joseph.
How you know my name?
Your granddaughter just told me.
You
Mr.
know
Joseph.
me.
Why's she telling you stuff about me?
Because she called me to come up here and talk to you. My name's Tannis Cordy. I
Okay.
work with the county EMS. Hi, little man. Hi, little man.
He wants to be.
That's the
EMS.
man right there.
That's your man right there?
There you go.
Oh,
You
yeah?
good, so.
Yeah.
Diego,
Fist bump, little boy. Fist bump.
say, Diego, will you
Good
tell
man, good man.
Grandpa that he needs
He's
to
a very
go
good
sit
man.
down? You tell him that Mr.
Can you tell him to
Janice is
sit
okay?
down for me?
Okay.
Oh.
There you go.
Would you like a
Yeah.
blanket?
You might feel better if you lay a blanket on.
There you go. All right. Can I put a?
He's not having a stroke, is he? That's not a
No,
stroke,
no,
is it,
no.
Tios? Are you sure? I'm
I
really
think so.
worried about
He's
him.
not drooping or he's not slurring. He's just.
Thank you, Sonny.
I don't think it's.
What, are you going to take his vital signs and check his blood pressure and
I
stuff?
will.
Okay, good. I'm really worried about Grandpa. He's 96
Mr.
years
Joseph,
old.
can you
Will
hold
you-
up both your arms like this for me, like it's a party
What
in the USA?
for? What for?
Because we're having a party in the USA.
I love parties.
Yes, sir.
I used to go to a lot back in my day. They were fun times.
Look me in the eyes real quick.
What you need?
All right, can you follow the light for me?
Sure.
All right. Shine one each way. All right,
That's bright. It hurts.
I'm sorry.
Why you doing that
I'm
to
gonna
me?
attach you. I'm gonna attach you right here to my computer, okay?
You doing what?
I'm gonna attach you to my computer
Why?
to look at your heart. You
Yeah.
ever had heart problems before?
Yeah?
Yeah. Well, let's make
Let's-
sure it's
let's-
no heart problems, right?
Alright. Alright.
So I'll put a blood pressure on them and you get a pulse ox.
These weird
Everything's
things.
looking good. I know. Listen, I'm gonna have to prick your finger, okay?
Why?
Make sure it's not your sugars.
That's gonna hurt.
No, it'll be real quick.
It's gonna hurt.
It'll be real quick.
I don't like pain, boy.
Oh,
I tell you
Grandpa,
what.
Come on, let him do his
It'll
job.
be real quick,
Real
okay?
quick and we get it over with, and then he can leave, and we'll be settled. We just need to know what are you doing, sugars?
Yeah.
We need to check his sugar, okay?
I don't.
You got diabetes, right?
I think so. What you need for
They
us?
cause it the
Well,
sugars.
you got the sugars.
Yeah.
Well, you know, I gotta make sure your sugars aren't too high or low.
Why?
Because if they're too low, you're gonna have a lot of problems. If they're too high, you can have a lot of problems. I can make sure that you're not gonna have any of those problems if you just let me check real quick, though.
I don't know, man. You sure about this?
Yes, sir. Listen, I give you my word.
You better be a man of your word, boy.
I'm a man of my word, yes, sir. All right, let me just check your finger real quick. Just a quick prick, okay?
Nah.
1, 2, 3. I know,
That ain't nice.
I know.
That ain't nice.
I know. I'm sorry. Here's a
Hurts.
Band-Aid. Oh, buddy.
Thank you.
Oh, don't throw that at Grandpa.
Him and Grandpa throw stuff at each other all the time.
All right, yeah, his sugar's 56.
56? Is that
Yeah.
bad? What's the normal
Yeah,
range?
he's not probably eating when he took his insulin.
56?
Oh,
Yeah.
That's a big number.
Yeah, that's kind of a small number.
For what?
Well,
What should we
normal,
do?
you want your
Should I
blood
just hold
sugar to
up
be
some
around
juice or
80,
something,
90
or
to 100.
Crackers? What do we
That's
do?
high. Why?
Because that's normal.
Oh,
High is like 200.
that's high.
That's real high.
Okay.
Yeah.
What?
I can give him some. You got like orange juice and stuff like that.
Yeah, well, that's good. Do we have orange juice, Grandpa? Let's
I don't know.
Would you drink a cup of orange juice for me?
Orange is good.
Orange juice, real good.
Yeah.
I got some candy flavored paste that I can put right here. Tastes like bubble gum.
Oh,
You like bubble gum?
Oh.
All right. So I'm gonna put some oral glucose right here. Can you massage your cheek for me like this? Just rub it in like that. Yes, sir. Just keep on rubbing for me.
that's weird.
That's weird. It tastes good though, right?
I guess.
drink you some juice, Grandpa, out of your favorite mug.
Oh, yeah. Good move right there.
It's a good mug right there.
Well, what do you need? Why are you here?
We're
I'm here
supposed
to
to
check
drink
it
the
on
juice,
you.
okay?
Okay.
And then we need to recheck your sugars, okay?
Okay. All right.
You feeling any better?
Absolutely. Thank you.
Feeling better?
Yeah.
All right. Would you like him to go to the hospital today?
I don't need to go
I
to the
don't
hospital.
know. I don't think this has happened. If it's just, I
Thank
don't
you,
know.
boy.
What
Thank
do
you.
you think? 'Cause-
Well, it could just be his sugars now.
I appreciate
I do
it.
recommend he goes to the hospital and make sure, maybe check his insulin dosage. But if he's not eating today,
Okay, so
Oh,
I
thank you,
mean,
Santa.
you
Can
won't
you
be
take
able to
this for
know
me?
it if it's just something simple, right?
Thank
well,
you.
I can't give you a true opinion there. From what I know, is
Good
they'll,
stuff.
they'll take you and they'll look at him,
Okay.
and they'll probably send
Well,
him back.
Grandpa, can we just go to the hospital and just make sure your sugar's okay?
Hospital.
I know, you don't like
All right.
hospitals.
Are you his power of
That
attorney?
for you.
No, actually, he's not that one. Sounds like something we need to discuss though.
Thank you. I appreciate it.
Aw.
I'll put that.
All right, Grandpa, so you gonna go to the hospital and just let us get you checked out?
Yeah.
I know you might be feeling better. Let's-
Ashley, you're my partner. Can you grab the stretcher? That's the stretcher.
Sure.
No, the car.
All right, we're gonna get you loaded up in our stretcher. And we're gonna take a ride, okay?
All right.
I'll get the stretcher right here for you, so you don't gotta move too much.
Thank
Sound
you,
good?
Sonny. I appreciate it.
Yes, sir.
Lovely, lovely thing.
All right, just hop right on in here. You need some help?
Absolutely, Sonny. Absolutely.
All right. All right. All right.
Some weird stretch right there. Some weird stretcher, but I appreciate the ride, Sonny. I appreciate the ride.
All right.
All right, Grandpa.
We're gonna take a quick ride to the hospital, okay?
We'll see you there, Grandpa. Thanks, Dennis.
Yeah.
Quinn.
Y'all so
I got
welcome.
you. I got you. Good stuff. Good stuff.